Hi, I'm Susan Carlson, and my second career profile choice is Federal Senior Social Worker. I interviewed Mrs. Hudnall from the Veterans Administration Office in one of the Utah offices. She also works as a medical social worker and a mental health worker. She says the VA is the largest employer of social workers in the United States. Her typical hours are 8 to 4:30, Monday through Friday. With it being a federal government, it's run by policy, so you have all the benefits of those policies. The job isn't super flexible, only in when you get to take your personal family leave time. With such a rigid schedule, it does bring comfort knowing that she just works the 8 to 4:30. Unlike more flexible jobs where you've got a lot of flexibility, but you're available 24/7, which can add a stress of its own. Typical stressors for her job is working with the seriously mentally ill population, and also dealing with the suicidal patients. Those things can be really overwhelming with the amount of information you need to sift through for your clients. So that stress really weighs down on you, which is why she says it's really important for self-care. Self-care that she takes advantage of is a lot of family time and being able to download with colleagues, not carrying the work with her. She says it's also very important to work through your own stuff before becoming a therapist, so being self-aware of your own issues. Besides the typical environment, the heavy workload of people in one day is also a stressor. The amount of paperwork can also weigh you down as well. The benefits are, and big perks, are family medical leave, so the family care time, and sick leave, which you can't be fired for taking, which makes them obligated to save your job for you, which brings, peace of mind knowing that if anything happened to you medically, that they would need to save your job. Federal employees have very satisfactory base pay, location pay, and all your health, dental, life insurance, time off, retirement, where they match everything you put in. When you retire as a federal employee and you meet the requirements, minimum age and length of duty, you have medical benefits the rest of your life. The years worked are 10 and age over 60. So common task, or ideally she'd like to counsel 20 hours a week, leaving 20 hours a week for paperwork, but usually it's 30 hours of counseling because of the demand. As a medical social worker, she works with the doctors, and as the mental health worker, she does one-on-one therapy. So generally 50 minutes of intervention counseling and 10 minutes for charting. So besides therapy, charting, notes, she has required meetings. She also needs to stay licensed, keeping her continuing education unit, so her CEUs current, which are required 40 units every 2 years, and renewing your license every 2 years. She also attends conference to keep up with the current medical aspects of her job, taking online tests and classes. Working with the hospital, she also has to keep up on her CPR credentials. So these are all done during the workday as well. In between clients, she checks her phone calls, checks with the doctors for home health orders, respite orders, looks for alerts from the hospital for suicidal patients, and completes suicide reports, works on advanced directives and end of life and caregiving situations. She's required to call the police or the APS for vulnerable adults, but is limited at the door, not working in the community. Besides suicide, mental illness, some of the other things she deals with is vets not having enough food, money for rent, homeless, and caregiver burnout. The education required is her master's and an LCSW, so a licensed clinical social worker license. In this federal government job, it's called being credentialed and privileged, so she's got to keep her licenses credentials current, as explained earlier. And to get the LCSW, she started with the SSW, which is Social Service Worker, and then she worked on her CSW, which is Certified Social Worker, which requires you to work under the LCSW, which is what she is, which is the highest license you can get. So she put in a total of 4 years of experience in education after her bachelor's degree. The starting range for the LCSW in the government at a level 12 pays at $75,000 a year, and an experienced range works on up to $91,000 a year. So the social work gives you a broad scope to choose from to specialize in, like children, elderly, school, medical, government, judicial, just to name a few. It's the license that makes you marketable, though, because most places are required to have a licensed professional in the building, which is great on equalizing older age as being a negative in finding a job. So as long as you've got those licenses and you've got licenses that you have while you're working on your master's, you make a lot more money. Thanks for watching.